dumating siya dito dead on arrival, tinry namin siya i-pack, i-perform yung CPR.
So this is where we house our COVID positive patients and COVID suspect patients. When do you start the control?
มองไปทางนู้นวันนั้นน่ะมีเคสเมื่อหนูก็ยกหลายครั้งเลยแต่ว่าอันเนี้ยเป็นการยกลงบันไดแคบๆซึ่งมันกว้างแค่นี้จริงๆหน้ากว้างแค่นี้คือถ้าคนข้างหน้า1ข้างหลัง2ก็คือหนูอยู่ข้างหลัง
We have the highest number of hospital care workers also infected with the Omicron virus, the 1,000 healthcare workers. Can you imagine working half of your staff and more patients are here, staying longer?
When their patient passed away, they got into the room, really cried, release whatever they needed to release,
24 months in crisis mode is a long time, really long time.
ถ้าพูดถึงโควิดกับการเปลี่ยนแปลงในชีวิตหนูเนี่ยเปลี่ยนเยอะมากเลยต้องเน้นคำว่ามากเลยเพราะว่าตอนแรกพอได้ยินคำเนี้ยกลัวเพราะหนูมีร้านหนูอ่ะจะเป็นมุ่งเน้นเกี่ยวกับเสื้อผ้าที่ขายต่างชาติทัวร์ปิดกั้นหนูเลยพอไม่มีทัวร์ปุ๊บยากเลยเพราะว่าหนูนี่สายแบบสายต่างชาติเลยเมื่อกรกฎาเมื่อปี 2564อ่ะหนูอ่ะครอบครัวหนูติดทั้งบ้านเลยแล้วก็ทำการรักษาแล้วมันเหมือนปลดล็อกความกลัวตรงนั้นนะคะว่าเรามีประสบการณ์ในการดูแลแม่แล้วทางเส้นได้เนี่ยเปิดโครงการนักรบเส้นได้หนูก็ตัดสินใจเนี่ยเข้าร่วมโครงการนี้
In last April, people were trying to call the call center of the government in order to get help for COVID. The people couldn't reach the call center at all, and people started to die on the streets. We are just a small group of people, but it's not that hard to solve these kind of problems. If you want a call center, we can just get 10 phones, 10 people to pick up calls, and we start roll out the call center. We turn our first pickup truck into a so-called ambulance for COVID patients.
กอดอกไว้จ้าพี่ออยช่วยดูกดมือให้หนูหน่อยนะโทษนะจ๊ะ
จับมือกัน
เงยหน้าขึ้นนิดนึงมองไปทางนู้นอย่านะอย่าดิ้นนะเจ็บอุ้ยดีมาก
ฟังเลย
หน้าขึ้นเยอะๆหน้าที่นะคะที่จะทำในเส้นได้เนี่ยของหนูเองนะก็คือเกี่ยวกับเคสที่เป็นผู้สูงอายุหรือกลุ่มเปราะบางที่เข้าถึงระบบการรักษายากๆหรือผู้ยากไร้เดี๋ยวหนูจะพยายามนะพี่นะหนูพยายามจะดันให้นะ
เดี๋ยวเราจะลอง
เขาก็ส่งหนูไปอบรมหลายที่มากหน่วยที่เข้ามาอบรมหรือที่หนูออกไปนะคะก็คือจะสอนตั้งแต่เบื้องต้นเลยการช่วย CPR แล้วก็การใช้เครื่องทุกอย่างเลยก็อยากจะตัวใหญ่กว่านี้นะถ้าพูดถึงศักยภาพร่างกายนะหนูว่าแต่หนูว่าใจมันสำคัญกว่าเพราะว่าหนูเคยเจอเคสที่ต้องยกคนไข้วันนั้นน่ะมีเคสเมื่อปีที่แล้วหนูก็ยกหลายครั้งเลยแต่ว่าอันเนี้ยเป็นการยกลงบันไดแคบๆซึ่งมันกว้างแค่นี้จริงๆหน้ากว้างแค่นี้คือถ้าคนข้างหน้า1ข้างหลัง2ก็คือหนูอยู่ข้างหลังหนูก็ถือ2ข้างแต่การถือ2ข้างมันทำให้หนูเดินลำบากเพราะว่าหนูตัวเล็ก
We think that we gonna just become like a interim group that if anyone needs beds, if anyone needs hospitals, if anyone needs transportation, you can just contact us. We'll do that until the government functions. We'll do that until the government can help you. However, it's been a year and it's still far from perfect.
ก็อยู่ที่นี่ก็อยู่ตรงข้ามกับศูนย์เลยอะค่ะห้องพักตรงข้ามกับศูนย์เลยก็มันสะดวกสบายดีค่ะบางทีแบบเราไปเคสมาอย่างเงี้ยเปียกทั้งตัวเราอยากเปลี่ยนชุดแล้วก็ขึ้นไปอาบน้ำแล้วก็ไปต่อ
We are ready to deal with whatever rolls in through our doors. Before resuscitation patients come, usually the SCDF gives us a heads up. Our concerns usually, I would say, twofold now in the times of COVID. Number one is this an infectious patient? Do they have a COVID risk? If they do, we might want to attend to the patient in a more appropriate manner, like an isolation room, or basically the COVID care area might be more suitable for such a patient.
The difficult part, I feel, is you don't know what will happen because emergency, anything will come. You don't know what's the patient condition. You are the first one who will encounter, so you really have to be alert and act fast.
Of course, I will feel stressed. People coming in, then you have to clear them faster so that they can see the doctor and being treated. Ambulance that keep on coming in at the gate there. The queue can be until the roads, waiting to be triaged and seen by the doctor.
Normally it's beep, 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 non-stop.
When the number of attendances at ED increases and we do have to utilize the extended facility at ED, then we'll trigger a team from the inpatient side to provide quick response within 2 hours.
If it's a weekend, we are expecting that there may be crowds coming to the emergency department to get treatment. And I think right now everybody is concerned about COVID. It's for the unexpectedly positive people, right? And we expect a larger number of them to be people with COVID-related symptoms, respiratory illnesses. I think people are worried about the symptoms, and some of them actually said that they were unable to get a slot in the GP clinic because it was really very full. So we are prepared to have many patients in our tents for today. So this is where we house our COVID positive patients and COVID suspect patients. Okay, where do you start? Your control then. Now we listen to your gut and it very quick out. So this is the mobile X-ray that we have set up in the tentage so that patients don't have to walk too far away, and it will help to improve our workflow. For the X-rays to be done here, and then the patients are just next door.
For COVID, we changed a lot of workflows and protocols. I think most of us can see that we're all wearing full PPE throughout our whole shift. In full PPE, usually you sweat a lot, you get drenched, dehydrated.
Outside air is the greenhouse effect. It's warmer. I think that you can go busy. You just want to get through the shift, and then you just forget about the physical discomfort.
So it's been 2 years of enormous hardship for everyone. Can we look back at some of the biggest challenges and how you overcame them?
Sure. Thank you. Thank you for the question. Ini donning area lah. Challenge was our staffs were fearful. All of us were fearful. We don't know what enemy is at hand with us or what are we going to face, But we kept ourselves calm, basing on the fact that we are infectious disease hospital. This is not something that we're facing for the first time because we had experiences of the past that made us confident that in the past we faced it well.
This is the entrance to the west wing of the ICU. When you enter this door, there's another main door inside. So that goes into the ICU. Today we have 11 patients inside the ICU.
8 of them are intubated, 2 under hyponasal cannula, and 1 is under a face mask.
All of us were fearful. So what we did was we educated our staff as we went along. We gave them continuous medical education on the particular virus in terms of how we want to train them for all the safety precaution, how to use the PPE, personal protective equipment correctly, and all the safety zoning and all that. So the doubts and fears, once that was cleared, then we have more calm individuals when they're working on the scene.
So how long this patient has been with us? Almost 10 days. This patient was admitted because actually more, not pure COVID actually. It's more towards the septic shock. So now our trend in COVID ICU, not only COVID patient, but then patient can also come with other problems.
As the pandemic progressed, we actually saw a tidal wave of rising number of patients. I could see my clinical colleagues were beginning to despair, and quite a few of them had not been able to even go back to see their loved ones because we're all like locked down and they've been missing their loved ones.
Healthcare workers, doctors, nurses, we are used to dealing with life and death. But the situation that we deal with usually is time limited. It may be over days, 1 or 2 days. It can even be 1 or 2 weeks. Sometimes we have floodings and situations that demands for us to work a bit longer. But imagine dealing with a situation that at that time, with no ending in sight, we are always on the go, always faced with the possibility of being infected, always have to work extra hours over the weekends. It is not easy being in such a situation where you're continuously bombarded by stressful situations over a period of 2 years.
Thank you to you all doing such a great job.
24 months in crisis mode is a long time, real long time.
For an emergency physician, time is of the essence. When they saw the patient was having difficulty breathing, the oxygen saturation is low, and the patient requires to be intubated.
Dumating yung arrest kanina, ongoing dialysis kasi siya. So may chronic kidney disease na kasi siya. So dumating siya dito dead on arrival. Tinry namin siya i-PAP, i-perform yung CPR. As a frontliner kasi dito sa ER, kami talaga yung magpa-perform na CPR sa patient.
Filipinos, because they're afraid, they don't know about COVID, they're afraid to go to the hospital, and then when they are already sick, they will preventing them from going to the hospital early. Most of the time, it's too late. We need to swab the patient to make sure that it's not COVID. However, because of the stigma, most of our relatives wouldn't want the patient to undergo swab tests. They don't want them to be labeled as a patient who was diagnosed with or died with COVID.
ตอนนี้มาตรวจเชิงลุกอะค่ะตรวจเชิงลุกให้กับคนไร้บ้านค่ะจริงๆโครงการที่เชิงลุกกับเส้นได้กับพม.เราทำร่วมกันอยู่แล้วตั้งนานแล้วอะค่ะก็คือพม.จะดูแลคนไร้บ้านส่วนเรามีหน้าที่ตรวจพอตรวจเสร็จเขาจะรับการรักษาทางเขาก็จะรับเลย การทำงานของเหยี่ยวราตรีเมื่อปีที่แล้วยากมากแล้วก็ดาร์กมากๆก็คือก็ราตรีจริงๆราตรีจะเป็นแบบจนเช้าเลยอย่างเงี้ยเคสที่สะเทือนใจที่เหยี่ยวราตรีทำก็ทำให้ทั้งที่เป็นแพทย์อาสาทั้งทีมงานหนูเนี่ยเสียน้ำตาก็ส่งรูปมาว่าเนี่ยคุณลุงนอนแบบคาอุจจาระตัวเองลุกไม่ได้แล้วอะไรอย่างเงี้ยก่อนหน้านี้ยังพอประคองเข้าห้องน้ำได้ตอนนี้ลุกไม่ได้เลยไม่มีญาติพี่น้องหนูก็เข้าไปหน้างานก่อนเลยแล้วก็เรียกหัวหน้าทีมหนูแพทย์อาสาเข้าเวรพอดีเข้าไปหน้างานเลยพอช่วยนู่นนั่นสุดออนออกซิเจนเรียบร้อยเพราะว่าแพทย์สั่งเนาะหนูก็ไปอ้อนวอนขอหน้าโรงพยาบาลหน้าวอร์ดฉุกเฉินเลยว่าพี่รับลุงคนนี้ให้หน่อยหนูไม่ไหวแน่ๆเลยถ้าเกิดปล่อยไว้ที่บ้านเขาแย่แน่ๆเลยแล้วทีนี้ทางแพทย์เขาบอกว่าแพทย์กับแพทย์คุยกันเขาบอกว่าเคสนี้ประเมินแล้วให้ NR ตอนแรกหนูก็ยัง NR คืออะไร NR แปลว่าปฏิเสธการรักษานี่คือคำย่อนะแต่ภาษาไทยมันแปลว่าคือการปฏิเสธการรักษาคือประเมินแล้วว่าไม่รอดก็คือไม่รับปล่อยให้รออยู่ที่บ้านหนูก็ทำอะไรไม่ถูกเลยนะตอนนั้นคือเอาแล้วหมอบอกว่าแพทย์ที่อยู่กับหมอเขาบอกเขาไม่ยอมเขาก็ขอร้องอาจารย์เขาก็คุยกับอาจารย์ข้างบนว่ารับให้หน่อยอะไรอย่างเงี้ยสุดท้ายก็โอเคไปถึงที่หน้าโรงพยาบาลปุ๊บโอเครับเคสของคุณลุงคนเนี้ยหนูก็ผ่านไปนานมากเลยนะหนูก็ไม่ได้รู้ว่าเขาไม่ได้ติดต่อกลับเลยว่าเป็นยังไงจนกลับมาที่มันมาระบาดอีกรอบนึงหนูก็ไล่ถามพี่ในชุมชนว่าพี่ลุงคนเนี้ยก็รู้อยู่ในใจแล้วแหละว่าไม่รอดอะไรอย่างเงี้ยก็รู้แหละแต่ก็ไม่อยากให้มาแบบพูดตรงๆก็เหมือนแบบหยาบๆแล้วก็นอนตายข้างถนนแบบนี้อะไรอย่างเงี้ยเราไม่อยากให้เป็นแบบนั้นอย่างน้อยให้เขาไปวาระสุดท้ายที่โรงพยาบาลแบบที่สุดของชีวิตแล้วพอได้ยินเขาว่าเขารอดเขาก็กลับมาเดินได้เขากลับไปอยู่ต่างจังหวัดไปปลูกไร่ปลูกนาซึ่งอันนี้คือแบบเฮ้ยมันแบบเหมือนเป็นพลังให้หนู
There's always a PPE patrol. He makes sure that we are wearing the proper PPE. This is the COVID ICU. So usually outside the ICU, we wear our complete, full PPE, just to make sure that we are safe and protected. Good afternoon. Hello. Good afternoon. How's our patient? Medyo mababa BP
Actually, medyo mababa nga yung BP, 89/44.
Can you check again the BP? These family members cannot see their loved one, so we only communicate with them through video calls. We have an iPad in the ICU, and that's how they see the patient. Okay, update lang po namin kayo regarding your father, Opo, andito pa rin siya sa ICU, Kami binabantayan lang po namin siya, Third day na po niya, nasa ventilator po. Binibigyan naman po namin ng antibiotics po ngayon, si daddy niyo po. May tanong po ba kayo regarding kay daddy niyo po?
If ever po ba, kailan po siya makapalabas ng ICU?
Dito po muna siya, ma'am, sa COVID ICU kasi po infectious pa po si sir, So, pag po na-complete na po niya yung number of days, paulit po namin yung RT-PCR, para ma-check kung infectious pa po siya or hindi.
Okay po.
It's very important that you treat the patient as a person because this may be a father, a son, a friend, a cousin, or a husband of someone. So you treat that patient as a person and you involve the family in the care of the patient.
We all know that when a COVID patient is admitted, the family cannot visit. In the intensive care units, we used to do video calls We will start at least like 12 o'clock. We'll start giving calls to the family, informing the family member how your family member is doing, how is his status today.
How is the patient doing?
But that patient is on a video call now because it's 5 years old. So make time with the family member so they can video call.
The most they could do was video call. Even for the last words, also video call. And so they're so dependent on our staff, and our staff like gave their best and their whole self to actually manning these patients.
God is there with you. God never leaves us, never leave us, never forsake us.
Emotionally, they were burned out. They were also sometimes affected when they see patients moving on, patients that they cared for so many days and maybe weeks, and then patients moving on with families all crying. You can imagine how it feels, you know. Some of them actually, when their patient passed away, they got into the room, really cried, release whatever they needed to release, you know.
What about yourself? How do you manage your own stress during the pandemic? What keeps you going?
Sometimes even I don't know how I faced it. I really don't know how I did it. It's hard. It's hard to imagine, you know, how you put everything aside and do your work only, you know, because I'm a wife also, you know, I'm a mother, I'm a wife, and it's not so easy, you know. My staff was like me, and we all knew the risk that came with being a healthcare worker. And I'm grateful with the steadfast support of all my colleagues, my doctors, my nurses, each and everyone in this hospital, and of course, my rock and foundation, that's my loving family during this important and trying time. So stress was there, but I kept it balanced.
I think the fear of being infected is always there. I feel a bit naked without my mask these days. Up to date in my department, over the last 1.5 to 2 weeks, we have about 40 plus staff of various job groups who have tested positive for COVID. I think that this is probably the time where COVID has come the nearest to our staff and our families. You can see the numbers is going up. I think we just try to focus on making sure that we're wearing our PPE, we're being careful, and taking care of ourselves in other ways. Yeah, so the last step would be the clearance of looms.
During the TTSH cluster, we need to provide confidence to our staff that whatever that we are doing will keep them safe.
I think that when the cluster happens, it was quite devastating for the morale. It really drove home to everyone that you really have got to be careful about this. Just one misstep and you get a cluster. And you realize the far-reaching consequences of thousands of people under quarantine and manpower is being affected.
You don't know how bad it goes because different people react differently to the diseases. We just take care of ourselves, do hand hygiene, that's most important at all. To keep ourselves safe from the disease, also our colleagues and friends. Of course, I do worry of my family that will get infected. Yes, I do. I really do.
วันนี้ออกมาตรวจเชิงลุกที่หัวลำโพงค่ะแล้วทีนี้ก็ถ้าคิดเป็นเปอร์เซ็นต์นะพี่หนูว่าประมาณ 40% ของการตรวจวันนี้ที่ติดแล้วณตอนนี้คือ คอนเนคชั่นฮอสพิทอลในมือหนูอ่ะก็เริ่มเบรกหนูแล้วก่อนหน้านี้เขาเบรกหนูแล้วว่าได้แค่วันละ5 คนนะ10 คนนะอย่างเงี้ยแล้วตอนนี้คือวันนี้หนูก็ส่งไปเต็มที่ละ10 คนมันเต็มโควต้าขอคีนฝั่งนี้กันระวังโดนแพดทีมภาคสนามเนี่ยทุกคนจะมีแบบมุมที่ระบายไม่เหมือนกันอย่างของหนูเนี่ยหนูเป็นคนค่อนข้างปากจัดอะไรเงี้ยแล้วก็เวลาคุยกับน้องๆอาจจะดูห้าวไปหน่อยอันนี้ในโหมดของหนูแต่ถ้าในโหมดของน้องๆอ่ะซึ่งมีน้องในทีมเนี่ยซึ่งเป็นคนที่พูดจาเพราะมากแล้วก็แบบเป็นคนระเบียบเลยแบบบุคลิกดีไม่พูดจาแบบหยาบคายเลยแต่สิ่งที่เขาระบายออกมาหนูว่ามันน่ากลัวมากๆเลยคือหนูว่าไปเคสมากับเขาแล้วก็หนักเหมือนกันเขาลงจากรถมาเขายังไม่ทันปิดประตูเลยเขาเดินไปตรงกำแพงลานจอดรถแล้วก็ปล่อยน้ำตาตัวเองออกมาพอปล่อยเขาไปสักพักหนูเนี่ยก็เลยเอาเรื่องนี้ไปปรึกษากับพี่โยที่เป็นแบบนักจิตแพทย์นะคะว่าแบบเนี้ยหนูอ่ะไม่ใช่แค่หนูไม่ใช่แค่น้องนะหนูควรปฏิบัติตัวกับเพื่อนร่วมทีมยังไงพี่เขาให้คำแนะนำว่าถ้าเขาปล่อยได้นั่นแหละคือนั่นคือการระบายถูกต้องแล้วที่เขามาปุ๊บแล้วเขาก็ระบายเพื่อปล่อยณเหตุการณ์วันต่อวันไม่ใช่เก็บมาแล้วปล่อยตัวหนูคิดว่าหนูไม่กลัวนะแต่หนูกลัวห่วงคนในทีมเพราะว่าหลายคนเลยในทีมก็มีเป็นภาวะซึมเศร้าแล้วก็เป็นซึมเศร้าที่รักษาตัวรู้สึกว่าทีมสำคัญเราหมดไฟในวันนี้แต่ไฟของน้องพุ่งในวันนี้มันเหมือนเป็นน้ำพุที่คอยแบบสลับกันขึ้นสลับกันลงอ่ะมันเลยแบบมันเลยยังอยู่ได้ที่แบบเราไม่ถอดใจอ่ะ
This is the hot zone area. So what we see here are critical patients, those who need medical attention, COVID probable or suspects. Since we are in the pandemic, if you have symptoms of shortness of breath, even cough, then you are labeled as a suspect until proven otherwise. Either positive or negative, we have 2 sets of ICU. The one that will cover with positive and that for the non-COVID. We actually had 5 surges already. After Christmas, when the peak of Omicron was very high, that's the time that you can see the nurses are very tired. A lot of hospital care workers who were also infected, a lot of them have to quarantine. We have a lot of patients, we don't have the manpower to cover for it. The patients would stay here from 24 hours up to the longest is about 3 days. Nursing care, even an ICU care in the emergency department. We have the highest number of hospital care workers also infected with the Omicron virus. It went up to about 1,000 healthcare workers. For the emergency department to function safely, we need about 125 nurses to serve all the areas of the emergency department. So during the pandemic, it went down as much as half of the staff. Can you imagine working half of your staff and then more patients are here, staying longer, and you're doing longer nursing care to your patients. So the workload was more difficult. We have to recognize that our nurses is very important in the healthcare industry. In order for us to function well, we have to compensate them properly, fairly, to commensurate what they are doing to the hospital or to the community.
Maybe we can hear what are the feedback from our staff on the ground, latest feedback lah, yeah?
So as you can see, majority experiencing some moderate level of burnout lah. There are a small group of people who are experiencing quite a severe, some depressive symptoms lah. Okay, they feel like so long already can they're dealing with COVID.
Healthcare workers have to deal with a situation which the full understanding is not there yet. That's number one. Number two, because of the scale of the transmission and the infection, they now have to work longer hours than before. And the third thing will probably be they also have a chance of being infected if they're not careful. So mentally, it's very stressful.
You're thinking about it, but so far they haven't quit yet. So some complaints about workplace, so some of them are nurses, some are doctors. So when doctors, those who have been in COVID, but previously they are in surgical departments, they miss their surgical procedures.
Yeah. Our psychiatry team provided peer support groups and also psychological first aid to our frontliners. And as management also, I also ensured that their rosters was done so that they had enough rest also, not only work all the time. I wanted them to have COVID-free days, and also our frontliners was not overworked. So personally, I've always kept an open door policy myself in case any one of my consultant doctors would need any sort of rearrangement of work or any form of help for our frontliners. Together, we could sit down and discuss, and then we could immediately institute it and carry it out.
A lot of our healthcare workers, they have children at home. Normally, these children are taken care of in schools. But during the pandemic, because of the MCO, because of the work environment, suddenly the children are left at home. So not only do they have to perform in the office environment, they have to wonder what the children are doing at home. So we also try to provide childcare for our healthcare workers to make sure that as little stress as possible will be experienced by them when they devote their time to managing the patients.
I'm very grateful to the extraordinary outpouring of generosity from all Malaysians, from sponsoring meals, daily necessities, clothes, other token of appreciation. That gave us a lot of happiness, and we felt that we were so loved. And this, I think, really boosted the morale of my frontliners, and it really made them work well.
You feel frustrated sometimes. I really tried my best to handle the situation or to send people to help, but I feel I never do enough. There's a patient that nearly threw a chair because of the long waiting for the results. I'm trying to talk to him so he can understand, but sometimes it just doesn't work. I'll call for help and also call for security. I will feel either sad or helpless. Usually we'll start with drinking first because in PPE it's like sweating all the way. So we'll drink water, then change our shirt. We have no appetite to eat. If can, we'll eat a bit, then we'll just sit and rest and sleep for a while. We are drained out sometimes physically and mentally, because you are working all around. Then mentally, when the patient just come to you like that, but you already try your best, but your patient just score you vulgarities, this kind of thing, you just feel hurt. It will be around once a week, yeah, but mostly our patients scolding, getting loud voices towards us, yeah, because of maybe a long waiting time of bed or waiting for the PCR results. For me, probably once a week, or my colleagues, or which I won't know as well. If everyone once a week, it might be a lot also.
So if patients still resist, then we'll switch to the figure park method.
From the videos, we learn how to handle patients, what should do, just make sure our own self, colleagues, and all the other patients are safe.
There is a panic button that they can press, would trigger our security officer from security to come up. We train our nurses tactics on how to disengage if a perpetrator were to hold them. A perpetrator may be pulling their hair, teach them how to disengage if that situation happens.
Maybe at least once a week we will have a patient who comes in and is maybe a bit verbally aggressive or sometimes a bit physically aggressive. It's quite often. I think most unpleasant, we actually have a patient, he will ask for food and Milo, and that's fine, we give it to him. But then at some point in the middle of the night, he will throw the water on the floor, he will throw the Milo on the floor, and once we give him this urinal to pass urine, and he threw his urine on the floor. And it was spattering everywhere. The patients around him were all, they were worried for their own safety, I guess, and of course, they were quite disgusted. And he was hurling vulgarities at the nurses, and he was throwing the tray boards at the nurses.
Today is a commemorative day where we first received our patient 2 years back. Yeah? 2 years back in 2020.
Ada yang berasa penat, bersedih, sedikit tertekan, bercampur baur perasaan. Sehingga tertanya-tanya, bilakah pandemik ini akan berakhir? Kita tanya hari-hari kan soalan ni, bilakah pandemik ini akan berakhir? Saya ingin menyeru dan mengingatkan semua bahawa kita yang berada di sini bukanlah untuk bersedih dan berduka, tetapi kita merupakan insan-insan terpilih sebagai barisan hadapan, frontliners dalam situasi pandemik ini. Justru saya amat berbangga dengan prestasi mantap yang telah ditunjukkan oleh semua warga hospital ini dalam mengharungi tempoh 2 tahun yang mencabar ini.
I consider all our staffs, from the cleaners to the engineers to the pharmacists to the lab technicians to the radiographers to the security guard, housemen, medical officers, specialists, administrative staff, my IT staff, all of them have gone above and beyond in the effort against COVID-19.
Marini?
It's teamwork. Our togetherness made us do it.
Thank you.
When I was appointed as a chairman during the height of the pandemic, it's a challenge for me to take the position and continue the job of the previous chairman. This challenge made me learn more and learn to adapt fast. I had some bad experiences during the first few months of COVID. A very close friend of mine, a doctor as well, my batchmate, died of COVID. I was also admitted. I was a COVID suspect because of reading of pneumonia in X-ray.
It's a little bit swelling because of the initial impetus, but I stopped. Okay.
After experiencing COVID for about 2 years and we already won the battle, I think I'm now in the place that during the time of surge, I know what to do already.
It's tiring after a long day of work, but at the end of the day, at the end of your shift, it's still fulfilling that you have done your job looking at your patient.
The first time we wear a full PPE, a level 4 PPE, it's plastic, it's disposable, and it's hot. And then you have to wear it for a longer period of time. You're really sweating inside, and then you are in a cold environment. So imagine that it's hot inside and a cold environment. It's very painful. It's also constricting. The gloves is constricting, the face mask is constricting. And then you have to limit your bathroom breaks and also your eating time. It's very difficult for everyone. It's difficult, especially for females who have to really doff off everything when they have to go to the bathroom. During the first few months of the COVID, some of them will be wearing diapers, adult diapers. But this is our job. We have to sacrifice. I will remember this as one of the most difficult part of my life as the doctor. The learnings with this pandemic, I will take it with me forever. It's not just administrative, it's not just being the doctor, but being human as well.
C3 system provides a real-time oversight of how beds are being utilized, and the information is critical for us to be able to forward plan the demand for further capacity. We used it at managerial level for us to be able to have quick sensing on the current situation.
In the last 10 days, the wards are filling up quite quickly. So sometimes we get messages from bed management unit that tells us there are no more beds available. We look into our current groups of patients. Some patients may be suitable for decanting to like a care facility. Some patients may be suitable for decantment to other restructured hospitals. We have some agreed protocols. So we try really much harder to see if there's any other option about that. Of course, we avoid unnecessary admissions as far as possible. Then the other thing as well is, like, for example, technology. In the past, the PCR swabs took a lot longer to come out, but now they're taking a lot faster to come out, and of course, it's not compulsory for everyone now. So as the disease progresses and we know more about it, technology has also shifted, and that has assisted to some extent to help us reduce the overcrowding and to get patients out and through the A&E more quickly than previously. How I can keep on going for these 2 years despite the uncertainty is because I found certainty in other aspects of my life. I started a part-time master's. It's taking up actually quite a lot of my time. Healthcare management, so it will help me do my work better next time. Say hello, I don't know how I'm actually managing to focus on both, but that knowledge of something firm and rooted in something that's structured and predictable helped to ground me for these 2 years while I face the unpredictability of COVID. As a doctor, I see 1 patient, I see 10 patients, I see 20 patients. But if I have an extra skill set that allows me to change the system, I can improve things for many more people at one shot. Then that's why I think it's worth it to do it.
สิ่งที่ทำให้หนูไปต่อได้เรื่อยคือมันไม่มีเวลาเสียใจคำว่าไม่มีเวลาเสียใจคือเคสมันเยอะอย่างหนูร้องไห้กับเคสนี้หรือดาร์กกับเคสนี้หนูมีเคสอีก 3-4 เคสต่อท้ายหนูมาแต่ถ้าหนูปล่อยให้ตัวเองดาวอยู่กับเคสนั้นไป 3-4 ชั่วโมงแล้วคนไข้อีก 3-4 เคสที่รอหนูอยู่ล่ะ
ยามที่เธอเปลี่ยวเหงาเธอไม่มีใครมาอยู่เคียงข้างเธอรู้สึกอ้างว้างหัวใจสับสนไม่มีผู้คนคืนวันที่ร้อนรนดวงจันทร์ดวงดาวไม่ส่องแสงมาใจเธออ่อนล้าฉันยังอยู่ตรงนี้ตรงที่คอยดูและคอยเฝ้ามองขอเธอโปรดรับรู้จะอยู่แห่งไหน
มันใช่เลยความหมายคือเพลงนี้เวลาหนูฟังทีไรอ่ะมันรู้สึกว่ามันเหมือนกระแทกมันเหมือนเพลงนี้มันเกิดมาเพื่อหนูจริงๆยิ่งดูแล้วคือมันเห็นตัวเองใน MV อ่ะเพลงที่คนอื่นอาจจะดูไม่รู้หรอกว่าคนนั้นเป็นอะไรแต่หนูอ่ะภาพที่อยู่ใน MV หนูจำได้หมดแล้วหนูชี้ได้ด้วยว่าเป็นใครในที่อยู่ในชุด PE นั้นเพราะว่าเราเห็นกันเองเรารู้ต่อให้ทุกคนในศูนย์ใส่ชุด PE แบบ50 คนเนี่ยใส่ชุด PE หนูก็จำได้ว่าคนนั้นเป็นใครขอแค่สายตาหนูก็รู้มันเห็นตัวเองใน MV แล้วแบบมันกลับมาแล้วความรู้สึกที่ว่าถ้ามันจะต้องกลับมาหนูก็ต้องสภาพมันก็จะเป็นแบบนั้นอีกหนูก็ไม่รู้ว่าทำไมหนูดู MV แล้วมันเห็นมันคือตัวหนูเองหนูจำตัวเองในนั้นได้แล้วก็รู้สึกว่าไม่อยากให้เกิดขึ้นอีก
สุดปลายฟ้าที่แสนไกลสุดแรงใจคือปลายฝันจับมือฉันจับมือกันคำสัญญา
We just normal average people but we like thread. Thread is small and it's thin, but thread is actually very useful. And if you rolling a thread together, it could be a rope or it could be a thick rope.
คำสัญญาเป็นเส้นได้